work as part of the Healthy Weight team, which is part of health and wellbeing services within the Community Trust. So our aim is to try and deliver programmes, interventions and schemes that help to address the healthy weight agenda for both children, families, adults across the whole of East Kent.
As GPs, we're seeing more children who are overweight or obese. Unfortunately, this is becoming an increasing problem in general practice. Children who are overweight or obese have far more health problems than perhaps we often realise. These can be long-term conditions such as physical problems, coping with their weight on their joints, muscle balance problems, and they have more emotional and mental health problems. So a system like the Ready, Steady, Go that we've been referring to has been wonderful for us because we can send our families over to this team and they come away with a sense that they can change their lives for the better.
We're going to make, I really don't know how to pronounce that. Tzatziki, and this is Greek, fat-free Greek yogurt.
We have a big team that's made up of nutrition specialists and physical activity specialists, and working together we deliver a number of schemes and interventions out in the community. We have family programmes that are delivered out in schools and leisure centres, specifically to support young people in how to make choices and behaviour change around healthy eating and physical activity.
Find a breakfast cereal low in sugar and fat.
What's your favourite, Kai?
Red peppers.
The peppers?
Obese children are very likely to become obese adults, and obese adults have a large number of health problems that are creating a large burden for the NHS.
I was referred by my doctor because I suffer with rheumatoid arthritis and COPD, and they referred me for 12 weeks. And I thought, yeah, why not? I'll give it a shot. I'm a hell of a lot fitter. I feel a lot better. My breathing's easier. And I just feel really good about myself.
I'm 76 and I haven't exercised for many a long year, so I feel that I've really benefited from it. I'm feeling much more flexible. I enjoy coming. It's not full of super fit, young, slim people.
One of the girls that I've met with, we're going to the gym together, so it's kind of meeting other people in the same situation as you, and so like buddying up and going to the gym and doing stuff together, so that will keep me going. Because I'm asthmatic as well, so it's helping that I don't take my inhalers at all now, so it's all good.
I was diagnosed as having emphysema through smoking too much, basically. I wasn't getting a lot of exercise because I couldn't breathe properly, and this is tailored to my needs, so it's doing me a hell of a lot of good. I'll probably be in hospital by now if I start coming to this.
We find that our clients are really valuing the specialist expertise that we can bring in the class. It's a very relaxing, welcoming environment.
Done, 112.
The Specialist Weight Management Service is a programme set up for patients that are morbidly obese, so that's with a body mass index of over 40. They can get exercise, dietetic support and psychotherapy support.
I'm a therapist within a team, so I work very closely with the physiologist and the dietitian. We've set up this year-long programme. Clients will come and see myself and then join a group, or it can be flexible. They can come and see me once or twice for an assessment and then join a group.
Roll the shoulders forwards, up, back and down now, circular movements.
What we're helping to do is to reduce the numbers of people that end up going for bariatric surgery.
I've definitely lost weight, and I feel much fitter for it.
When I started the course, I was on 4 tablets a day for my diabetes, and now I'm down to 1. Hopefully, when I go down a bit more, perhaps I might be able to stop them altogether. I think our patients need a 3-pronged approach.
It is a more holistic approach. I don't think you can do one without the other.
These are the pyjamas that I was wearing in January, and then I put them away for the summer, and when I got them out again for the winter, they clearly didn't fit. And now I can get both legs in one leg of the pyjamas.
First of all, we want you to be eating all your different food groups. So as you can see, you've got a large portion of carbs. When a client comes to see us for their first appointment, we will go through the British Heart Foundation booklet, and that will include your Eat Well plate, which is the different portions. We'll go through the amount of portions of each that they can have a day.
If somebody'd like to come onto the scheme, they need to be an adult and they need to have a BMI of between 25 and 35. The benefits to gradual weight loss is that once the weight is gone, it's not going to come back on so quickly. If you go onto a crash diet, it's gone, you feel fabulous for 3 or 4 weeks, and then gradually, and then it just comes back when you go back to normal eating. Diets can be very restrictive and you think, oh, it's so boring. We don't want people to be bored, we want them to be motivated.
Some people need a little bit more help. Some people just want to go for a walk and just do a little bit more daily activity.
It's the feel-good factor.
We have up to 80 health walks running a week across East Kent, and we have volunteers that run these walks in a number of different locations, and it's just about people going out, meeting other people, having fun, going for a walk together and just being more active. And we know that that really positively impacts on health and well-being.
Gets me out and about, meeting people and being healthier.
Something to do, otherwise sitting indoors doing nothing, can you?
Exciting dynamic event is brought to you by the Healthy Weights team as part of the NHS Healthy Weights service.
A food champion is you get given 3 goals, and 3 of our goals were to do a display board in one of our centres, to incorporate a healthy lunch in our YAPS group, which is Young Active Parents, and also to start a new sustainable group incorporating healthy messages and healthy eating.
I work at the Six Bells Children's Centre in Margate, as well as Cliftonville Children's Centre in Cliftonville and Thanet. And we're here to receive our food champion status. We've worked really hard to get our group up and running, so it's a real privilege to be invited to come in and tell everybody what we've achieved.
You attend the training, which is provided by the NHS Healthy Eating Group, and then within your goals you are passing on educational information on healthy eating messages, healthy lifestyles. It's important for us because we work with children of 5 or under, so we're hopefully capturing children at quite a young age. Also we work in one of the highest deprived areas in Kent, so along with deprivation obviously comes poverty, and families are really struggling, especially recently on the benefit reforms. A lot of their benefits have been cut, so being able to eat healthy on less money is essential, and more so than it's ever been really.
We advertise through things like Facebook and Twitter now, which has proved to be quite a good source to get people interested and on board. I work closely with schools in the community and lots of community-based clubs and groups as well. I'm like working alone at the local council. It's really good to have the support of the NHS team, you know, to back up and to encourage and support the work that I'm doing.
Oh, I think mine's looking better than yours. The families that we've referred to the Healthy Weight team have had very successful outcomes. They've all had the tools to improve their diet. They've all learnt ways to increase their activity levels, and generally we're seeing that their children and the whole family are improving their weights.
What people traditionally think of the NHS as being that clinical care, when somebody's ill, how do we make them better? So we're very much about trying to support people in their own homes, in the community, making lifestyle changes and more small step behaviour changes that will impact on their whole health and well-being for a lifetime.